This is Dr. Mukhtar Rima. Today I'm going to talk about obsessive compulsive disorder. Obsessive compulsive disorder is a mental health condition that affects a very large number of people all over the world. As up to about 2% of people globally have a lifetime risk of developing this disorder. So, how would you recognize the condition and what should you do if you or a family member has this condition? So let's dive a little bit deeper. Obsessive compulsive disorder is a condition, as the name suggests, that presents with two categories of symptoms. Basically, obsessions on one hand and compulsions. And people who have this disorder may present with either the obsessions alone or the compulsions or both at the same time. So what are obsessions? Obsessions, as the name suggests, together with compulsions, are the hallmarks of the disorder. So what are they? Obsessions are thoughts, processes, some thinking, or sometimes urges or images that come into the conscious awareness or into the mind of individual who have this disorder. So they could be thoughts, like I said. They could be images, not images as per you see pictures, but mental images, what is seeing things in your mind's eyes. Or they could be urges, having some irresistible desire to want to do something, and those things, the thoughts, the images, and the urges are unwanted by the individual because they result in significant amount of distress. So one of the things that makes these thoughts, images, and urges to be significant enough to be considered as obsessions is because they tend to be persistent, which means when the thought comes into the mind of the individual and the individual recognizes them as their own, but they nonetheless do not want them to come into their mind, those thoughts tend to persist for a period of time, and they are also recurrent, which means even when they leave the conscious awareness of the mind or of the individual, they tend to recur. So the fact that they are persistent and they are recurrent makes them, or partly qualifies them, as obsessions. But additionally, for the thought processes to be considered as obsessions, the individual do not want to think about them. He does not want to recognize them. He does not want them to come into their mind, into the mind of the individual who has this condition. Additionally, the thoughts are intrusive, which means the thoughts would want to force their way, or they often succeed in forcing their way into the mind of the individual who has this condition. So the presence of this kind of thoughts, images, or urges which are unwanted and they are intrusive, which means they force their way into the mind of the individual, and that they are persistent and recurrent, makes them to be considered as obsessions. One other characteristic of these thoughts is that the individual who experiences these thoughts, images, or impulses or urges tends to want to make effort at preventing them from experiencing these thoughts. So one key thing about obsessions is that people who have them want to find a way, or they usually attempt to block them, or to ignore them, or to suppress them, or to otherwise neutralize them. And that is why some people who have obsessions tend to do a number of things. Either that they do some things a certain way just to make sure, or in an effort to make sure that those thoughts, those obsessions do not keep coming back into their minds. Those actions that are done by individuals in a bid to prevent the obsessions from coming into their minds are called compulsions. So that brings me to the next category of symptoms of obsessive compulsive disorder, which are compulsions. So compulsions are repetitive behaviors or mental actions that individuals with obsessive compulsive disorder do with the aim of preventing or avoiding, or at least relieving the anxiety that comes with the obsessions that they have. So when people have obsessions, they would likely carry out some actions, which could be mental actions, or they could be behavioral actions that are aimed at neutralizing those obsessions that started them in the first place. So a key example is individuals who have obsessions of doubt, because obsessions like we said, can come into the mind of the individual in form of thoughts or images or urges, right? Now, these thoughts could take various forms. Sometimes the thoughts could be in form of doubts. So a certain thought process will just force its way, I would say, rudely into the mind of the individual, maybe making him to doubt something, maybe making him to doubt an action that he has completed, or making him to doubt something that he considers or that he believes as a fundamental truth. So, an example of an obsessive doubt could be that an individual who is religious, and all of a sudden, when he begins to have obsessive compulsive disorder, begin to doubt the existence of God, for instance, and the thought will persist. The thought will keep recurring, and it will be intruding into the mind of the individual, making him to doubt maybe the existence of God. Another form of obsessive doubt is a situation where an individual has done an action, and then all of a sudden an obsessive thought will keep coming into his mind, making him to doubt whether he has done that action at all, or whether he has not even done it completely. So one key example is somebody who has turned off the gas in the kitchen, or has done a certain transaction if he's a banker, and then a thought will come into his mind, making him to doubt whether he has done that action. So it will now be followed, or he will feel compelled to carry out a certain action, which is meant to relieve the anxiety that comes with that kind of thinking. So the thinking will tell him, oh, you've not turned off the gas. Oh, you've not done this transaction correctly. Now, that thinking initiates an anxiety in him, okay? And then the thought will not leave him alone. It keeps coming back. It persists for long into his mind. And then for him to have relief, he will have to go and check, right? That is the most logical thing to do when you have this kind of thoughts coming into your mind. So he will have to go and check whether really he has not turned off the gas, or he has not done a certain transaction correctly if he's a banker. And then he comes back, and when he sits down, the thought will not leave him alone, and it will recur, and that will make him to have to go and check again. So you can imagine that people who have obsessions, and when they are followed by compulsions, they tend to spend a lot of time doing a particular thing that they should have been done with, and that waste their time, and that results in what is called obsessive slowness. Another thing that results in obsessive slowness is that people who have obsessions sometimes have an urge to do things in a certain pattern or in a certain order. So, for instance, a lady who wants to get ready to go to work will have to do some things in a particular order. Maybe she has to do something before she goes to bathroom. When she goes to bathroom, she has to do things in a particular order. When she comes out, she has to dress and tidy up herself in a certain order. And all that pattern, all that arrangement, all that ordering rather, would waste a lot of time, and that will result in obsessive slowness. And that comes with their own, those things come with their own complications. So that would result in wasting time, making him or her go to work late. And now you can imagine the kind of impact of that on their quality of life and their functioning. So if they have to report to work at a certain time, but because of the obsessive slowness, they report late, that will come with a lot of reprimands, and sometimes some people may even end up losing their jobs. So this is how people with obsessive compulsive disorder present. Another category of symptoms another presentation of obsessions is that particularly, like I said, religious people, sometimes a thought will keep coming into their mind, making them think of something that they consider blasphemous. So if something tells you that God is unreal, or there is no God, or this whole concept that you previously believed in is fake, or it's just a figment of your imagination, then you can imagine that people like that would feel significantly distressed. Now, these categories of people will also want to do something to relieve that distress and anxiety that come with that thinking, right? So some of them tend to do some certain rituals that could be physical, or sometimes the rituals could be mental. So, for instance, some people that have some certain forms of OCD, obsessive symptoms, tend to carry out some certain mental rituals, such as repeating a certain prayer a certain number of times, or counting some things a certain number of times, with the belief that when they do that, those obsessions will stop. But unfortunately, those obsessions do not stop because they are naturally and inherently recurrent, and they are intrusive. And that would result in a significant distress in individuals like that. So, obsessive compulsive disorder presents with a myriad of symptoms. The obsessions could take various forms. There are times when an individual has an obsession in which he keeps having a thought that he may have been contaminated, or if he does something, or he becomes fearful of being contaminated, or having infection, or having or fear of being contaminated, essentially. So those kind of people, as you can imagine, would have what we call compulsions or rituals of cleaning, where they clean their selves. Or so you can imagine that those people will not want to shake hands with people, or they do not want to touch doorknobs, or they do not want to do a certain number of things. Now, that obsession or fear of contamination has resulted in a compulsion, such as wanting to clean themselves, clean their hands, or avoiding some certain kinds of behaviors. And if, for instance, you are in a job where you interact with people a lot and you need to shake hands a lot, you can imagine that those people would be distressed, and they may end up having complications to do with those kinds of work. One misperception that is associated with obsessive compulsive disorder is the thinking that somehow people who have this disorder are possessed, or they have a weak mind, and that's why those intrusive thoughts keep coming into their minds. Now, there is nothing that can be further away from the truth. Obsessive compulsive disorder is a mental health condition, which means it is an illness that people who have some certain predispositions develop. And it is an illness that can be treated once it is identified, and there are effective treatments. The treatments that are available for obsessive compulsive disorder include what we call psychotherapy, where an individual undergoes what we call talking therapy with a psychologist. And the kind of treatment that is found to be most effective for obsessive compulsive disorder is called cognitive behavioral therapy. There are also medications that are found to be very effective. The first line medications that are found to be very effective in the treatment of obsessive compulsive disorder are called selective serotonin reuptake inhibitors. These medications are found to be effective in relieving the symptoms of OCD, but if the individual has the ability, or there is the presence of a psychologist to give the cognitive behavioral therapy, it is found to be more effective. All right, so overall, this is obsessive compulsive disorder. The symptoms of obsessive compulsive disorder essentially are made up of obsessions or compulsions, or both. These obsessions and compulsions result in clinically significant distress. They result in impairment in the functioning of the individual, and it therefore means that if the condition is not identified and treated, it could result in individuals losing their jobs, or resulting in a significant amount of distress that reduces the quality of life of these individuals. All right, that's it for today. See you another time. Thank you.